Do you have concerns that you may be suffering from depression? If so, it's important to make sure you don't have any underlying health concerns that may be at the root of the problem. Psychiatrist Dr. Joshua Weiner joins us now to talk about the most common health problems that can mimic depression. So I didn't even realize that there could be underlying health problems that make it look like or appear that you have depression. Can you tell us more?
Sure, absolutely. So when somebody has depression, by definition, they have a period of 2 weeks or longer in which they're having sad mood, low energy, loss of interest in things that they used to enjoy, maybe some suicidal thoughts, feeling of worthlessness, helplessness, concentration problems, etc. Now that can be due to depression, but in order to be truly diagnosed with depression, you can't have an underlying medical condition that's contributing. So what you want to do is you want to make sure you don't have one of these conditions. So the big things that you want to look out for are things like thyroid problems, low levels of vitamin D, low levels of vitamin B12, chronic inflammation, and there can be a blood test to look at that, or an underlying sleep disorder. Those are going to be kind of the big things that you want to rule out before you go to say, well, this depression is due to a psychiatric condition rather than an underlying health condition.
You did mention a blood test. Are there ways that you can be sure that it's not something else and when you know that you actually are suffering from depression?
Absolutely. So all of the things that I just mentioned, except for the sleep issue, because if you have something like sleep apnea, that's going to require a sleep study. But all the other things can be checked with a simple blood test. So you're just looking at things like your vitamin D level. Now, one thing I'd like to mention, in particular with vitamin D, is it'll say that the normal range for vitamin D starts at around 30 and goes up to around 100. I do not think that 30 is a sufficient level of vitamin D. So if you get your vitamin D level checked and you're at 30 and you're having some symptoms of depression, it might be wise to consider taking a vitamin D supplement. You really want your vitamin D level to be closer to 50 or 60. But to your point, yes, a blood test can look for these things.
And so when you realize, though, that it may be something more serious, how do you go about making sure you find proper treatment and get the help that you need?
My advice really is to start with your primary care physician. So you can go in with your physician armed with the information that I just said, and you can say, hey, I'm having some of these issues. I'm concerned that I'm depressed. Would you mind looking at some of these things to make sure that there's not an underlying condition going on? You get the results of that stuff first. If all of that comes back normal, then at that point, you certainly want to look for somebody in the mental health field, preferably a psychologist or a psychiatrist who can take it from there.
And I really think so much of it is being aware of your own health and how you're feeling, right?
Absolutely. And the other thing really is being an advocate for yourself. You really have to do your research. And now it's easier than ever. You can go online. There are reputable sites like the Mayo Clinic and things of that sort. And you can research some of this stuff so you're armed with information and you can actually advocate for yourself. And you can say, please check these things. I really want to make sure that I don't have one of these things going on.
Yep, it's so important to take care of yourself. Dr. Joshua Weiner, thanks so much.